So as of 2023, the ASPS, so the American Society of Plastic Surgeons, procedure and statistics release. It comes out like in the early summer, I think. And I think we actually talked about it. We were talking about what's trending, what's different. Throw that picture up there, Travis. I'm going to talk about it. Oh yeah, there's the title. So why liposuction number one plastic surgery? Yeah, so this is the report. And just to kind of recap the top 5, liposuction, roughly 350,000 surgeries done. Breast augmentation, a little over 300,000. Tummy tuck, 170,000, breast lift, 154,000, and then blepharoplasty, which is eyelid surgery, 121,000 procedures done in the United States. Nothing really shocking there. Liposuction and breast aug kind of like flip-flops back and forth between number 1 and number 2 each year. I think lipo's had it for the last 2 years. So somehow I got talking about this past week with a patient because we were talking about what are the most popular procedures, and they were kind of surprised that liposuction was number 1. And then, I started thinking about it, and it's a little surprising to me, too. I mean, just based on the consults we see. And so I thought it'd be interesting to talk about why is it number 1. And so I think the main reason that it pops up number 1 on this list is because liposuction is done with so many other procedures.
Yeah.
I mean, we talk about the big one that I hate all the time. You know which type of surgery I hate?
Yeah, BBLs.
Yeah, Brazilian butt lift. I mean, Brazilian butt lift is liposuction. I mean,
I had liposuction on my.
Oh, you did when you had your surgery?
Yeah, because the doctor was trying to get rid of my little chicken.
Oh, yeah.
I call them my little chicken nuggets, but he didn't really get rid of them.
Accessory breast tissue. Yeah.
He didn't get rid of them.
Yeah, in fact, I've done that many times. And so I think that's why this pops up number 1 on that list. I mean, because you never hear people talking about, I just went and got liposuction, by itself. It's I went and got liposuction tummy tuck. So there's a lot of procedures that get liposuction in conjunction with it. Brazilian butt lift, tummy tuck is super common. I probably do liposuction on 75 or 80% of my tummy tucks. Arm lifts and thigh lifts, it's really common just to kind of thin it out. Gynecomastia repair, which is when men have like the man boobs going on. Any other fat grafting, so like when people do fat grafting, with a facelift, there's going to be liposuction. And then, of course, like all the isolated liposuction procedures that are out there. But all in all, outside of the fact that it's done with a lot of other surgeries, it is extremely popular. And, I think it's worth talking about, why is it so popular? So, the main reasons come to me, very predictable results. If somebody knows what they're doing, liposuction's pretty straightforward as far as getting the result that you want.
Yeah.
It's basically sculpting is all it is. And, most plastic surgeons are artists, so they can, get a good sculpt at the end of the day. Recovery's pretty easy. I'd call it easy to moderate. Definitely not a bad one. Complication rates overall very low. I'll kind of go over those in a minute. And then, when you look at the patient satisfaction rates, it's very, very high. But, for people who are either thinking about liposuction, or just want to learn more about it. There's a saying that I always say, I don't know if I made this up or I heard it somewhere. I don't always hear other people say it. I may have made it up. I don't know. But it's, yeah, I know, right? Liposuction is a contouring procedure, not a weight loss procedure.
Yeah.
You shouldn't go into liposuction if, you feel like you need to have your whole body liposuction. At that point, then it's best just to lose weight. And of course now with, things like semaglutide, that's become easier than ever. But the main goal of liposuction is, I think if you're doing it by itself, it's contouring, meaning, if you have like a place where fat's bulging, that's a great use for it. But if you come in and you say, well, I want to liposuction my entire leg, not so good. Well, I have people come in and ask that, not all the time, but from time to time, they'll come in and be like, can I just get liposuction all over? And there's people out there that do that, and surgeons, and it just puts you at risk. When you start to liposuction that much, it starts to become a little bit more risky because when used as intended, it's
so
actually.
So, for girls, do they, what do they come in for the most? Because if
for
they,
lipo,
for legs, is it your inner thigh?
Inner thighs, yeah, that's the classic one.
And then, for stomach, it's that little lower belly.
Yeah. Lower, yeah, that's exactly right. Yeah, those are, well, I'll tell you, the area that I liposuction the most by itself would be I call them the flanks. Yeah, the love handles or the saddlebag area. I call them flank. It's that area, the two places that women gain fat the most, or tummy number 1, and then 2, like the flank. So like basically your sides, but going around towards the back.
Yeah.
And so what I end up doing a lot is, I do tons of tummy tucks. I usually do about one a week. In fact, I just finished one like an hour ago. When you do a tummy tuck, you'll make everything in the front really, really flat. But then, a lot of times women will have a little bit off to the side, and then they notice it more.
Yeah.
And I'd say probably, 1 out of 3 or 1 out of 4 tummy tucks come back and end up liposuctioning that later. I don't like to do it at the same time. I actually did that early on in my career, and I noticed that when I liposuction people on the sides with a tummy tuck, at the same time, they were more
like too much.
Yeah, they were more prone to have like healing problems. Like nothing terrible, but I did notice that, and so I've gone away from doing that. And now, if they want to do that, then we do it a second. But as far as like how liposuction is done, I mean, it's fairly straightforward. The first thing you do is you inject the area of fat with something called tumescent fluid, and so tumescent just means like swollen, but the tumescent fluid is basically a solution of normal saline, and then it has epinephrine, lidocaine, and bicarbonate. And what the tumescent fluid does, it actually does several things. One, the epinephrine decreases bleeding.
Okay.
It's really effective at constricting blood vessels. And so, when we do liposuction, I mean, most people hardly lose any blood at all. The lidocaine helps for anesthetic. I do almost all of my liposuctions under general anesthesia just because it's so safe. And we can dive into that, I guess, in a little bit as far as can you do under local. You can do these surgeries under local anesthesia, and in that case, the lidocaine is super important. But the other thing it does is when you inject the fat tissue with this fluid, it makes it firmer, and then it's much easier to sculpt.
Oh.
Yeah. So the tumescent fluid does a lot of things. So you inject the tumescent fluid first. I usually make 6 millimeter incisions. So you're talking an incision about like that. They're tiny. I usually do 2 per area. So if I'm doing an area here, I do them at 90-degree angles. So I do like 1 here and like 1 there. And so that lets you kind of cross hatch, so you're not getting the cannula going all in one direction. So I make the incisions, inject the fluid. I usually use the debulking cannula at 6 millimeters. I got a picture of a cannula. I remember adding one. I'll throw that up there just so people. Yeah, so that's a classic liposuction cannula. It's longer. It's probably 3 times as long as it's shown in that picture. And then on the end is like a metal piece that connects to a suction hose. And so it's not sharp at all. It's actually blunt. And when you apply suction to that and run that through the fat, it's very effective at just kind of shaving it down, almost like I said, almost like you're sculpting. So yeah, I debulk it with a bigger cannula. Then I go to like a smaller one so that I can like just do I call it fine feathering. It's basically tidying it up and making sure everything looks exactly the way you want.
Yeah.
And then you close up your incisions. I mean, it's pretty easy actually. There's artistry in it for sure, and so you have to kind of have that eye or the experience to make it look right. But technically, it's not challenging. As far as like the post-op instructions, pretty straightforward. You got to put compression on there because what ends up happening when you do liposuction, you're sucking that fat out of an area, and it makes a space. And anytime you have a space in your body's natural reaction is to put fluid in there, especially when there's inflammation from the trauma of the surgery, like your blood vessels get leaky, and they don't necessarily leak blood, but they'll leak the serous fluid. And so, we put compression on that to basically smush that space back together. So did they put compression on your arms or your side area when they did it?
No, I still have a scar from it.
Oh, do you? Yeah. Yeah, I mean,
But
it really
I scar really easy.
Do you? Yeah.
Yeah. Olive skin.
A little small area like that, it's not as critical to put compression. But like if you're doing big areas of liposuction, like your flanks, your abdomen, your thighs, you definitely want to wear compression. If you don't, you significantly increase the risk of complications. No exercise or heavy lifting is also a very important instruction, and you got to give yourself time to recoup. 2 things about liposuction that definitely need to be known for something considering. One, swelling is 100% normal and expected. In fact, I tell my patients that depending on how much you're taking out, like the swelling may mask that you've had the procedure at all, especially if you're doing something small like inner thighs or like the chin, which is another area where you're just barely doing liposuction. The tissues are going to swell, and you can come out of this and not even see that anything is done.
Yeah.
So you have to like educate people about that so they don't freak out. Of course, if you're doing bigger areas of liposuction, they never swell as much as you take out. So, they're seeing like a partial result. It takes about 6 weeks for the majority of the swelling to come out, and then it can take up to 6 months for that last little bit. So just got to be aware of that. The other thing that's really important to know with liposuction is, what is the skin going to do? Because what happens when people lose a bunch of weight?
They get saggy.
Yeah, they get saggy skin. Well, when you do liposuction, it's instantaneous.
Yeah.
And so it's not like if you're, losing it with diet and exercise, or even things like semaglutide or weight loss surgery, that it can be fairly fast, but not as fast as lipo. I mean, lipo is instant, and so the skin doesn't have a time to kind of snap back as much as when you're doing it more gradual. And so that's definitely something that you have to think about when you're doing this is, okay, are you doing so much liposuction that you're going to be unhappy with how your skin looks? And once again, preventing problems or unexpected results is all about your surgeon explaining that to you. But if you know that going in, you can ask your surgeon, hey, is my skin going to be loose? Most of the time, skin will snap back, and then it's just a measure of like like how much did you remove? How old is the patient? Is the skin quality good? Is it bad? A good surgeon can tell you what to think about the skin. As far as risks of surgery, we talked about, I think just like a couple months ago, we talked about the dreaded risk of lipo where I think we were
like
talking.
You can like hit an artery or something.
Yeah, get internal with it. Like
I think somebody got in trouble.
Yeah, I think you're right. Yeah, you like hit the liver, hit the intestines. I mean, you really have to like either one, not be paying attention. Like,
yeah, it was a case. The person,
the girl
died.
Did she die? I can't remember. It was the girl who lost her license because she was TikToking.
No, there was another person.
Oh, there was another one. Oh my gosh.
He like ignored it and sewed her up, and then she like went to like go somewhere else to fix it, and then she died or something.
Man, I don't know if I'm getting older if we've just done too many segments because like it's like we talk about
because they all kind of sound the same, and we're every single time we're like, whoa,
wait a second.
How's that happening?
Yeah, so that's like the big dreaded risk is if the liposuction cannula gets way out of bounds and causes an injury. Realistically, a good surgeon should not have that happen to them in their career.
Yeah.
It should be a risk of like 1 in tens of thousands. It can happen, but it really shouldn't. But so like, what are the real risks? I mean, to me, the biggest risk of liposuction far and away is seroma, which is when people collect fluid. I've had it happen to me twice in 15 years. I'm not sure those patients.
That's not really something you can control as a doctor. Right?
Really not. No, I would agree with that. I mean, I think probably the biggest risk factor for people getting seroma is if they're not just religious about wearing the compression, or if they're like overly active, which is hence why the number 1 and number 2 instructions are wear compression and no exercise or heavy lift. Yeah, I've had 2 seromas that I've had to deal with over the years, which is not bad. I mean, that's over 15 years. And then the other is the other risk would be if like the skin scars down to the muscle if they over liposuction people. I always talk about that when we're talking about Brazilian butt lifts, how they like skeletonize these people's fat and then sometimes they'll scar. There was I can't remember if it was Britney Spears or it was Tara Reid. Remember that girl from the 90s? She was like in American Pie.
She looks rough now.
Does she really?
Oof.
Oh, I haven't seen her.
She's
I'll have to look her up.
Oof.
Really?
Yeah, she looks like
she's not aging well. Or
she
she's like
looks
living a hard life.
She lives in a house where drugs are. That's what she looks like.
Okay. As soon as we stop this episode, I'm totally gonna go look her up. Okay. Anyway, Tara Reid, if I remember correctly, got some liposuction where they overdid it, and there was
on
a famous
stomach,
yeah. Have you seen that picture?
Yeah.
Oh, okay, cool. Yeah. So you don't want that. I've never, knock on wood, have never had that happen to me because it's just a matter of leaving a healthy layer of fat tissue underneath the skin. And then lastly would be any contour issues, meaning, did you make a mistake in your sculpting? I've gone back once or twice and touched up something, but it's exceedingly rare. So I get a bunch of questions about liposuction that are kind of interesting, and so I kind of like made a little list here. So will the fat that you remove, will your body put it somewhere else? It's not a bad question. Answer to that's no. I mean, just because you pull fat out of one area, it doesn't mean that suddenly your body's going to be like, oh, well, there's no fat in the abdomen. Let me go and put it on your butt or somewhere. No, that doesn't really happen.
The way you said that, sorry. Let me go ahead and put it on your butt.
Yeah, like your body's like, we're going to have to like compensate for this somewhere else. Can you gain the fat back?
Yeah.
Yes, you can, of course. Sure, yeah, you can. You can get it back. It's basically like getting you where you want to be, and then you're starting fresh, right? So you got to make sure that you kind of keep the body that you want. Will you need skin tightening? We were just talking about that. That's definitely something the surgeon should talk to you about. Your surgeon should go over what's going to happen to the skin. If they don't, then they're not really giving you all the information, which I'm really big on that. So, but yeah, so all in all, a lipo is a good surgery. It's at least in my opinion mostly done in conjunction with other things, but on its own, it's great. I mean,
it sounds like it depends. It obviously depends on the doctor, but it sounds like it depends on the patient, I guess, to keep it the best.
Right.
In terms of taking care of it afterwards and then
not
definitely gaining it back.
Yeah, following the instructions. And
most
then,
effective, I guess.
I definitely think that the patient's got a lot of
more responsibility.
Yeah, responsibility. It's important to follow the instructions so you don't get a problem, and then you have to maintain it afterwards.
Yeah, because it's not like a boob job. You can't just
right.
You're not going to lose your boob. Your boobs aren't going to get bigger, and they're not going to get. I guess they could get bigger.
I mean, they could. If you
just in terms got bigger.
But the thing is, with lipo, you're targeting an area where your body likes to put fat there.
Yeah.
Right. So.